When you get your braces, I start the movement of your teeth with a very light, flexible wire to slowly begin alignment. These wires are so flexible that sometimes chewing normal food or even biting down in your sleep can cause the wire to slide out of the back brace. But here's an easy solution.
This long, loose wire can certainly be uncomfortable to your tooth, cheek, or gums, but fear not, because the emergency solution is so very easy. Position a light so you can get a good look at the wire. Using tweezers, grab the wire near its end so that only about 2 millimeters is sticking out. Flex the wire and insert it into the open end of the last brace. Remember, the last brace is just a hollow tube with nothing inside to hold the wire. Once the end of the wire is in place, you can use the tweezers to finish sliding the wire through the last brace until it's straight. Sometimes the last brace has been knocked off and you're left with a long poking wire that has no brace to be placed back into. This is solved with a pair of household fingernail clippers. Simply slide the clippers along the long wire until you reach the back of the last brace that is glued to your teeth. With a firm squeeze, the extra portion of the wire will be cut off. This solution can also be used if you're unable to slide a long wire back into that last brace, or if the wire is too short to slide into the last brace. Please don't remove your entire wire. Using the above directions, you can solve the problem while still allowing your teeth to continue their alignment.
You do some great work. I better not tell you too much more or you'll be a great orthodontist yourself. Uh-oh, if you're watching this video, you must be having some discomfort with your braces, or you just want to know what to do in case you have some. Either way, here's some surefire tips to offer solutions to the discomfort you may be having.
During your time in braces, there may be instances where something is rubbing, poking, or just doesn't seem right. If a brace or wire is rubbing against your lip, dry the area with a Kleenex or napkin. Pinch off a small piece of the provided wax and press it on the brace that's rubbing. Wax also works well when you have a small amount of wire that may be poking at your cheek. If you don't have your wax with you, you can also use a moist cotton ball or even a piece of chewing gum to alleviate the discomfort of a poking wire. At times, the doctor will use small tying wires to hold the main wire into your braces. If an edge of this tying wire is irritating your lip, you can gently push it under your wire using the eraser of a pencil. Much better. Sometimes a brace may come loose from your tooth for any number of reasons. As long as the wire's not poking you, you don't have to consider this an orthodontic emergency.
Oh, that's great!
The brace remains attached to your wire by way of the colored tie or tying wire. Although this brace may feel different than your other braces, it's not doing any harm to your teeth. The doctor will evaluate this tooth at your next scheduled appointment to determine whether or not you need to replace the loose brace. If the doctor has instructed you to attach a rubber band to the brace that is loose, you'll want to contact our office and inform the staff that you cannot attach your rubber band due to the loose brace, and we'll schedule you for an evaluation appointment.
I hope these tips have addressed your orthodontic concern. If you still have questions, don't hesitate to contact our office.